So your teenage child has been diagnosed with a functional neurological disorder, short for FND, and then you might be wondering, what would happen if you don't do anything about it, or if your teen doesn't do anything about this FND condition? Like, is it going to go away on its own? So let's just see how it goes, or is it actually going to get worse, and your worst nightmare can become the reality? Well, in this video, I'm going to talk about what's going to happen if you don't do anything about FND and what you can do to actually prevent things from getting worse. Well, so let's dive in. Hi, I'm Dr. Lee here, pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program specifically designed to help teens and their parents resolve FND. So I have had a lot of opportunity working with teens and their parents with FND, and I'm just going to cut to the chase. There is a chance of this thing called spontaneous recovery. So your teen maybe doesn't need to do anything and then just get better on its own. Voila, yay, great, move on. But most of the times, if that happens, then the consequences is they're gonna have these symptoms again somewhere down the road. And when they do come back, they usually come up with vengeance. So here's a typical scenario of what it looks like. So let's just say your teen is seemingly normal and healthy with maybe, I don't know, some anxiety or recurring injury or illness or something like that. But for the most part, you guys are doing okay. Until something happens, whether it's a known thing like a concussion or out of blue, your teen starts having these odd symptoms. And you and your teen don't know what's going on there. So you obviously take your child to the hospital, typically ER, because you and your teen are freaked out or just thinking about the worst case scenario. What if this is a brain tumor that we didn't know? Or what if this is some sort of like a really bad virus and now my child has a Guillain-Barré? Anything like that, right? However, when the doctor runs a test, everything comes back normal or negative. It's meaning that there's nothing going on, right? And then everyone's scratching their head thinking, oh my gosh, how could this be, right? It's not normal for my child to be acting like this. So parents are insisting on running more tests, most likely, while teen is feeling very invalidated and confused and then worried if everyone is thinking she's faking. Doctor is reluctant to do anything in the meantime and just wanting to send the kid home. Or they are just as freaked out as you are, if not more, and wanting to run 10,000 more tests or keep the kid in the hospital for days, weeks, and months. But eventually, at some point, your child is being sent home with no answers, or oh yeah, we just couldn't find anything. There's got to be functional neurological disorder or FND. Go see a therapist. You don't need to come back here. Something like that. Which, by the way, if that's still happening or if it did happen to your case, I want to know who the doctor is because I really want to educate the doctor. Shouldn't be talking like that. All right. So you're home and parents, you guys are watching your child like a hawk and watching every single detail about your child, like with clipboard, like checking, like, oh my gosh, how many times and how long were you out and then what kind of symptoms you're having and that kind of thing. In the meantime, the child is staying home and then thinking, I cannot go to school like this. There's no way. And you are also thinking, I agree with you. We cannot send you to school like this and demand the school to babysit you. There is no way. Then the several days turn into weeks and months, maybe some ups and downs. Some days are good, some days are bad, but generally speaking, it's upside down. And now the school's over, whether it's a summertime or there's a long holiday break, and then suddenly, guess what? Things are better, right? Like either much less symptoms or no symptoms at all for your child. And the parents, you're like, thank God, we are back to normal or somewhat normal. Not sure what it was, but hey, it's behind us now, so let's just enjoy the summer or let's just enjoy this time. Then the summer's over, then the school starts. Guess what? Within a few days or weeks, your teen is back on having the same symptoms. If not, now they're getting worse with so many more frequency, intensity, and now these new symptoms are coming up and it's just out of control. So what's going on here? Once again, there is this thing called spontaneous recovery, and it's a real thing where your teen doesn't really need to do anything and get better, right? But most of the time, at least with my experience in my clinical setting here in private practice and also online coaching program, Teen FND Academy, kids just don't get better. That's the reality of it. So why this is the case? Well, so this is typically what happens. And I hate to say it, FND is not a life-threatening emergency, like a cancer or brain tumor or stuff like that. However, well, brain tumor is a type of cancer, but FND is just as debilitating, as you know already. So you cannot just ignore and then thinking, let's just see how it goes. There is no let's just see how it goes. Okay. And even if your child is doing everything she's supposed to be doing, the recovery is never going to be linear. It's going to be up and down, up and down, up and down. But if she doesn't do anything, or if you don't do anything as a parent, then what's going to happen is this up and down, but staying a plateau. All right. So there's a big difference between up and down, and staying plateau, and up and down, but going uphill. There is a huge difference between that, right? So how is this different from any other life-threatening emergency or medical condition? Well, FND is very common diagnosis, but you don't know what it is. That's the problem. FND is real and it is a biopsychosocial problem. So the great news about FND is it's absolutely treatable and it is curable, especially teens, you guys. The odds of you getting better from FND is much higher than adult who's got FND. So then what would happen if your child is, let's just say 17 and then turns 18 in maybe a few months or next year or whatever? Is it going to be like a hidden wall that your child is suddenly turning 18 and not going to be able to get better? Well, that's not really the case. However, the longer you wait, the chance of your child getting better completely goes downhill. And I'm not saying that you should do this right away, like emergency situation, but you can't just have this, let's just see how it goes. Well, she got better during summer, so as long as we change the school, everything is going to be fine. Again, it goes back to FND is a biopsychosocial phenomenon. So school is part of the social. So you also need to think about biological and emotional factors, right? And once again, as long as you're working with FND specialists who knows what they're doing, especially working with teens, then the chance of you getting better is really high. And again, you're still going to have this up and down, but as long as you're doing the right thing and right approach, then it's going to be up and down, but going in this direction, right? But if you don't do anything about it, it's not going to go away. Like a cavity. You know, if you have a cavity, you can't just say, well, let's just see how it goes. Well, it's not going to get better, right, on its own. So same thing. So it really starts with you needing to know exactly what FND is, and it is not the time to rely on Dr. Google and pretend you know everything about FND. And again, FND is not just one thing that it's causing. I hear some families saying, oh, it's gotta be this supplement, lack of, or this vitamin level low and things like that. Sure, but not everyone who is low on this thing has FND. So it's not just one thing that is causing it. All right. No, you don't need to freak out. You don't need to panic about it or feeling trapped. You don't need to think about it that way. All right. However, working with a specialist is really the key here. Otherwise, you're kind of playing with the dangerous fire. And speaking of the fire, I use a fire analogy. FND treatment really starts with knowing what it is and then how to be done with it. Okay. And then you think about why this is happening. And in my online program, Teen FND Academy, that's exactly what I'm teaching. Starting with the what of FND, how you can get better, and then only then we talk about why this is happening in the first place. It goes back to this biopsychosocial phenomenon. But if your house is on fire, you're not staying inside the house and figuring out where does this fire come from? Unless I know exactly what happens, I'm not going to go anywhere. No, you need to get out and then put out the fire first, right? And then when the fire is basically done, then you figure out what happened along with a specialist. So FND is the same thing. Yes, you're an expert as a parent of your child, and you can work with expert of FND as well. So just to kind of recap, the nugget here is your child has been diagnosed with FND or having these FND conditions. You can't just not do anything. Not doing anything is not the solution here. And your child might get better, called spontaneous recovery, but usually it comes back with vengeance. So why wait? That is really the nugget here. And again, if recovery from FND is a priority for you and your family, then you might qualify for my program. Click the link below to schedule a call to talk to me today. Thank you so much for watching this video, and I will see you in the next video.